So again, we have the whole structure here is a zygomatic arch. Look for the suture line. So the part that belongs to the temporal bone that sticks out, so for this part here, the long skinny portion, that is the zygomatic process of the temporal bone. Okay, so on mine it says number 48. Okay. If we look at the zygomatic bone, the cheekbone essentially, look for the suture line again. So the suture line is here, and so the process is shorter. How much sticks out from the zygomatic bone is shorter. So from here to about here is the temporal process of the zygomatic bone. Okay? The whole structure is a zygomatic arch. Now, when it comes to quiz or an exam, how do you know what I want you to identify? If I put a sticker over here, kind of in the middle of the temporal process, the zygomatic process of the temporal bone, I'm wanting you to name the actual process, not the whole arch. Okay? If I put it on the other side of the suture, again, I want you to name the temporal process of the zygomatic bone. If I put a sticker right over the suture and say structure, so I'm hiding the suture, I want you to know to name the entire structure, then you're going to say, okay, that's the zygomatic arch. And you can always ask questions when you're in a quiz and say, do you mean this part or the whole part? I'd be happy to say the whole part. Okay, so you can always ask. I can't give you the actual name or the answer, but I can help point out exactly and clarify things for you.
Do you get a word bank?
Yeah, I have to get back to you on that. I can't remember what I did last year. So I'll let you guys know in class. But you do need to know the names. Okay. Very good question. So we've already done the lacrimal canal when we talked about the lacrimal bone. So we're going to move to the sella turcica, and that's going to be on the inside. So you take that skull cap off again. We can leave it off now. Okay. Now somebody yesterday blew my mind. They actually knew what sella turcica meant. Does anybody know what it means? Huh? Sella turcica. Does anybody know? It means Turkish saddle. Yeah. So, and it's part of the sphenoid bone. Told you it's going to come up again. So, we have our anterior cranial fossa. We have our middle cranial fossa. Right here, this structure, kind of right where I'm putting my pencil in the middle, is where you'd put your bottom in the saddle. Okay? So this lovely structure here is the sella turcica. So in the older saddles, kind of Middle Eastern, Asian, in older times, the saddles had swells in the front and the back, kind of like you see here, if you kind of pretended that was a saddle. If any of you have ridden horses, know that that would not feel good if you got bucked or something, because it would not feel good. But so it literally means Turkish saddle. So it kind of looks like a saddle. And so if I wanted you to identify that, I would put a sticker right down there in the middle. Okay, there's nothing else there that you would have to identify. So put it right there. That's your sella turcica, or portion of the sella turcica. Okay, we'll do the mandible in a little bit, so we'll come back to that. Go to the top right. We've already done the perpendicular plate of the ethmoid bone. So the next on our list is the superior and inferior orbital fissure. Okay, so you're going to be looking into the eye of your skull. So page 128 or 130 will be good pictures for you to look at. 130 is a pretty good close-up. Okay, so you are looking for your superior and inferior orbital fissure. So we'll do the superior part first. So look into the eye. You'll have to kind of go at an angle So I'll try to say, oh, you got it. So, right, oh, let me see if I can go from the back. Okay, see my pencil coming in from the back? That's your superior orbital fissure, where the light is shining through there. So if you look into the eye, kind of at an angle, you'll see there's like a jagged line at an angle above, okay? And then if you kind of look down at the floor of the eye, let's see, how do I angle this better? There we go. The floor of the eye, here, you'll see another jagged hole. That's your inferior orbital fissure. So a fissure is kind of like a jagged opening or a crevasse or whatever. So in the eye, you have these two jagged openings. Jagged one on the top is your superior orbital fissure. Jagged one on the bottom is your inferior orbital fissure. Now, do you guys see another hole in there when you're looking in the eye? Yeah, it's like almost a perfect little circle. See if you can find that in yours. Anybody know what that one is? Yeah, optic canal or optic foramen. What do you think's passing through there? The optic nerve. Excellent. Yeah, so it's perfect little circle, okay? And the optic foramen is, you can find that on the list of foramina, a little lower on the list on the right-hand side. Okay, still looking at the eye, we're looking for this superior orbital foramen or notch. So this is one where on some skulls it's an actual hole, and on others it's a notch. So that's going to be above the eye, and this one, you can see it on both sides, it's actually a little hole. Now this little bridge here that makes the hole is gone, and so it's a little notch instead of a hole. And it just depends from person to person whether it's an actual little hole or it's a notch. You can feel it on yourself, so if you feel the ridge of the bone, you should be able to feel a little notch or a little hole. So it's going to be kind of up from the corner of your eye. And so I can feel mine. I'm pretty sure it's a notch on mine. Okay? So you can feel that pretty well. Let's see. Then you have what's called the inferior orbital foramen, and this one's always a hole. So inferior is going to be below the eye, and it's a fairly big hole. Okay, so below the eye, about here. It's harder to feel because you have more tissue there, but you have vessels and nerves passing through here. A big nerve, like the facial nerve, it's a very big nerve, passing through that area. Some people, if you push hard enough, you can feel it, but a few times people have said ouch when they do that. Maybe pushing too hard. Okay. So we got that. All right. Now we're going to look into the nose. Okay. And so if you have a really old skull, you might be missing a few of these structures. So look at a newer one or look at this one for reference. Okay. So you have what is called the inferior and medial nasal concha. I love saying that word, concha. That and fossa. I love saying fossa. Okay, so the inferior nasal concha. So first of all, there's our septum. What two structures make up the nasal septum? The vomer. Perpendicular plate of the ethmoid bone. Okay? So notice on either side there's a bump. Okay, and then if we look up high into the nasal cavity, there's another set of bumps, right and left. The bottom one is the inferior nasal concha. The one up above, higher, that's your middle or medial nasal concha. These suckers are there to increase the surface area of your nasal cavity. Okay? So we talked about how we increase surface area when we talk about cells having the microvilli. So these increase the surface area. It's covered in mucous membrane. Increased surface area means more surface for sensory receptors for smell. Also helps warm up air as it's coming into your body. Okay, okay? Or vice versa. Also helps conserve fluid, water, prevent dehydration. So there's many reasons you have those concha there. Okay, so let's see, we did optic, stylomastoid. Okay, the incisive foramen or fossa depends on your skull. That's the next one. So we're going to take a look at the underside of our skull again, an inferior view. Where are your incisors? It's a set of teeth. Do you know which teeth those are? They're not the canines. They're the two front teeth. Okay? So if we're looking for the incisive fossa or the incisive foramen, either way is fine. You're going to find it behind the two front teeth in that palatine process of the maxilla bone. So some of yours will look kind of like a slit, especially you're going to have variation if it's a real skull. Yes, ma'am?
Where is that on our list?
Okay, it's under the list where it says foramina. I know we're just jumping around a little bit. Bear with me. There's a reason for all of this. So the incisive is under the foramina list on the left-hand side, number 4 down there. Okay? So you find the incisive fossa behind the incisors on the hard palate, right here. So since we're still looking at the underside again, we are going to look at the next 3 on the list below the foramina. So mandibular fossa of the temporal bone is next. Okay, so what bone are we going to find this feature on? On the temporal bone. And so a fossa, what's a fossa? It's technically not quite a hole. It's more like a big indentation. Okay? Not fossa. I have to say it. Okay. So there's gonna be like a big indentation or like a cave kind of structure in the temporal bone, and it says mandibular. So it means it's going to be associated with the mandible in some way. Where would the mandible come in contact with your temporal bone? So you're pointing on yourself. That's good. Find that on your skull. So mine is one of the newer ones, and it shows like the cartilage. But it's going to be kind of, if we're looking underneath, posterior to the zygomatic arch. If you have a real skull, it's just going to be a nice, smooth indentation there. Okay? Between your zygomatic arch and your styloid process. A nice, smooth indentation. You can probably get your whole finger in there if you don't have a cartilage pad in there. So that is where your mandible, this lovely guy here, articulates with the jaw. Articulates with the skull, sorry. And the mandible, or that articulation with the mandible and the skull, that's the only movable joint in the skull, is the mandible. Okay? So, next on the list is the greater and lesser wings of this. Oh, wait, we'll come back to that. Okay. Medial and lateral pterygoid process. Since we're looking at the underside, we're going to do that part first. Medial and lateral pterygoid processes. Can any of you guys find that? Let me check. I don't know if that one's labeled. It's not labeled. So if you look at page 125, okay, it's part of the sphenoid bone. So the sphenoid bone is pink. Okay, so look at that, and then I'm going to show you here on the skull where you find it. So remember where our vomer is here? Okay, we have this lovely center divide. Okay, on either side there are 2 thin flares, like 2 thin walls of bone that kind of flare out. Okay? It's part of the sphenoid bone. So this thin wall that's closest to the middle, this is your medial pterygoid process. And you have a right and a left. So you have one on this side and one on this side. And then the other thin kind of sheet of bone that flares outward is your lateral pterygoid process. You have one on this side and one on the other. So this is, I'm putting it in, okay. So this is the right lateral pterygoid process. This is the left lateral pterygoid process. And then the medial one is closer to the middle, okay? And these are important because you have two muscles that are attached there. So you have the medial pterygoid muscle, and then you have the lateral pterygoid muscle that attach to those. So that's why it's named that way. So part of, I just forgot the name of the bone. Yeah, part of the sphenoid bone, sorry. Okay, look inside the skull, last one, and then we're going to do the mandible. Okay? So, last one there, greater and lesser wings of the sphenoid. And if you look on page 126, you should be able to see that. So, sphenoid again. And this is... You're good there?
Falling asleep.
Wake up, Brad. Okay, so look for the suture lines. So there's a suture line here and a suture line all the way here. So you have a thin little ridge. Okay, that's kind of the border between the anterior and middle cranial fossa. This little ridge here is the lesser wing of the sphenoid. Make sure I'm saying that right. Lesser wing of the sphenoid. And then down below, look for the suture lines. It kind of looks like a butterfly. You have the greater wing of the sphenoid. The greater wing of the sphenoid actually forms the back wall of the orbital cavity. So the back wall for your where your eye would be. Okay, so lesser is the small thin one on the top. Greater is the bigger one on the bottom. Combined, it really kind of looks like a butterfly. So lesser because it's small, greater because it's big. All right, we're going to take a break and go to the mandible. We're getting close to the end, guys. We're doing so good. Okay, so if you want to look at a good picture of the mandible, it's on page 130. Okay, so first of all, we're going to just be looking, if you don't have a mandible, actually, guys, there's a drawer over there that says mandible, so especially if you have a real skull, you probably don't have a mandible. Why don't you guys quickly, let's pause, quickly go get, let's get back to these suckers here. Okay, so first of all, we're just going to look the very front of the mandible. There's like a little point in the middle of the chin. We call that the genu, G-E-N-U. And you'll notice in your book, it says, there's one page where it mentions it. Oh, okay, it mentions it on page 128, and it calls it the mandibular symphysis, also known as the genu, okay? We're going with genu because it's easier, and it is another term for it, and genu was only used once ever, and that's for your chin, that point of the chin right there. Okay, so on this mandible, it's number 18, that point. If we turn it to the side, you'll see there is a foramen on either side of the genu, okay? Anybody want to tell me what the name of that is?
Mental.
The mental foramen? Yes. So the mental foramen on either side of your chin, okay? Then we want to find or define where the body of the mandible is. So the body of the mandible is essentially from this point here, by the way, this point where the bone appears to bend, that's called the angle of the mandible. So from the angle of the mandible all the way to the front, essentially, this whole portion of the bone is called the body of the mandible. Okay? So we have the body of the mandible and we have the angle of the mandible. And you do need to say of which bone, because as we continue, you'll find out that we use the word body a lot on different bones. So if you, let's say on the quiz, just say, oh, that's the body. I'm going to say the body of what? Okay, so that's not a correct answer, unfortunately. So you have to name the bone. So body is one of those terms that's used multiple times. Angle is not, but it's still best to name the bone to cover your bases. Okay. So we did the body, we did the angle. Okay, the next is the ramus of the mandible. And so the ramus is basically from the angle here to the mandibular notch. Okay, so from basically a line from here down to the angle. So this portion of the bone is the ramus. And the term ramus also comes up in other bones. So to name this correctly, you would, let's get really, really real. This would be the left ramus of the mandible. Okay? That would be the 100% correct answer. So it's on the left side. This is the ramus region, and then of that bone, of the mandible. Zoom tight. Okay. Now, we are going to look for the coronoid process. So if you guys have a mandible, I want you to find it, hold it up and point to it. The coronoid process. Okay, you guys got it? Got it? Yeah, yes. So there's two processes that stick up here on the mandible. The coronoid is the sharp, pointy one. Okay, so this is the coronoid process. And just as a reminder, when we have the term process, that means there's a bone that's projecting out. So it's this whole structure that's sticking up and out. Okay, so from here up, that's the coronoid process. Now we're going to look at two structures, the condylar process and the condyle. Okay, so there is a distinction here. So remember, the process is the part of the bone that's sticking out. So from here to here is the condylar process. The condyle is just the upper smooth surface. Okay, the condyle, which is labeled number 20 here, this is the part of the mandible that is actually articulating with the temporal bone. So it's the smooth, rounded surface. That's all that it is, the condyle. Okay? Condyle is a term you're going to hear a lot. So to correctly name this, this would be the left condyle of the mandible. And if it's below the condyle, so if it's this portion of the bone, that's the condylar process of the mandible. Okay? So condyle is the upper smooth surface. The process is the bridge of bone right here. Okay, so if I stuck a sticker here, I'm wanting you to identify the process. If I stuck a sticker right on the top, then I want you to identify the condyle. Okay? One more thing for the mandible. And it's the mandibular foramen. Can you guys find that one? So look at the picture, it's fine. It's going to be on the mandible though. Okay, that group has it. Anybody else? Ah, they have it. Okay, that group has it. Good. All right, looks like you guys are finding it. Yeah, so the mandibular foramen is on the inside, okay, or the inferior portion of the mandible, kind of in between or down below your coronoid process and your condylar process. So it's this kind of depending on your mandible, it might look like a slit or it might be a really obvious hole. That's your mandibular foramen, and you have it on either side. So that's your left mandibular foramen and your right mandibular foramen, and you got lots of nerves running through there. Okay? That is it for the mandible. Now we just have 8 more foramen to go, and the last 8 follow a really nice pattern kind of around the base of the skull. So before we go over each individual one, I have an acronym up here on the board for you. And so I would recommend writing this down. Carl, he just can't speak out really loud. So with acronyms, we're looking for the first letter of each word. And so the first letter of each word stands for the name of the foramen that you're going to know. And these are all in order around the base of the skull. So I'm going to give you a minute to write that down, and then we're going to go over each foramen on the skull. Okay? The last 8 foramen around the base of the skull. Okay? So we have the order, and we're going to go directly down the list. And this list, we're starting with the condylar foramen, and we're basically going to be doing a lovely little loop like that. Okay? So the very first one, Carl, stands for condylar, and that's the back, the posterior to the occipital condyles. Again, depending on the skull, it might just look like a fossa. Some you actually see a physical hole. Everybody's skull is slightly different. Okay? So this indentation or hole right at the back of the occipital condyle. That's your condylar fossa or foramen. Okay, what's the next one on our list? Hypoglossal. Now this one is kind of interesting. You're going to find it underneath the occipital condyle. So here's our occipital condyle. If we go at an angle, bam! The occipital condyle forms kind of like a bridge. You see that little hole there? Where is it? Right there. So underneath the occipital condyle is this lovely hole that goes all the way through, and that's the hypoglossal foramen. So basically your occipital condyle is a bridge, and the foramen, the hypoglossal foramen, is the hole under the bridge. Okay? So you'll have to turn your skull at an angle to see that. Hypoglossal. Okay, from the hypoglossal, which basically, if we have an imaginary line, runs this way underneath our occipital condyle, what's the next foramen on our list? Jugular. So look at your skull. Where does the hypoglossal foramen come out? It comes out right here. That's the other side. I'll put it back. So we just drop down to the next one. It's a big one. Let's see. Can you see that? Oh, okay. There you go. So hypoglossal is right here, and then the next one right there is a big one. If you look at it from an angle, it's quite large. That's the jugular foramen. This is where your jugular vein, right and left jugular vein, is passing through down through the skull, down the neck, draining the blood from the head. Okay, so it's really quite large. So if you kind of keep your finger there with the jugular, or your pencil like mine, what's the next one on the list? Carotid. So if I'm at the jugular, I'm just going to move up one spot, and it's pretty much like a nice round circle. Okay? And if you look at it, look at the skull at an angle, you'll notice that the actual carotid foramen is also kind of at an angle, going up into the skull, but it's a nice smaller round circle. Okay, and that's where your carotid arteries, the right and left carotid arteries, are entering the skull and bringing blood up into the skull. Okay, so there's the carotid. What's the next one on our list? Spinosum. Okay, since we're going in a nice little loop around here, if we have carotid, the next hole that's directly anterior to it is this nice little tiny perfect circle. See that? So here's the carotid. Spinosum is right above it. Some of yours will be smaller than others, especially on a real skull. So carotid, spinosum. Spinosum is like a tiny perfect circle right above the carotid. Okay, from the spinosum, what's the next one on our list? Oval. And that sounds a lot like oval. So go right above the spinosum and we have a lovely foramen that's the shape of a oval. That helps, right? It's the shape of an oval and it's named after the shape. That's nice. We have 2 more to go. So if I'm at the oval, what's the next one on our list? Rotundum is a tiny one. And this one is tough depending if you have a real skull. It might literally look like a tiny little slit. So from the oval, you're going to find the rotundum right here. And it's in between your lateral and medial pterygoid process. There's a tiny little hole. Okay? Look between the medial and lateral pterygoid process for a little hole. That's the rotundum. It's itty bitty. I don't believe I've ever actually tested this one because it's hard to get something in that spot. Don't put it past me. I do come up with new ideas. So you do want to know where that little dude is, okay? Just on the off chance I figure out how to get something to stick there. Okay, so the rotundum is just anterior to the oval. It's a tiny little guy. What's the last one on our list? Lacerum. So from there, we just drop straight down or posterior to this big giant hole. Okay, and that's the lacerum. So with these 8 foramen, we're basically doing a lovely little loop around the base of the skull, okay? And so if you follow the actual order, you're essentially kind of doing this, okay? Going this way. So you have your condylar, your hypoglossal, then you have your jugulars, which is big. Then you have your lovely round, what's the round one? Carotid. And then above the carotid, we have a lovely little circle, tiny little circle, spinosum. Then we have our oval, or lovely oval. I'm trying to make them the right shapes. Then we have a little tiny dot. What's the name of the little tiny one? And then lastly, lacerum, which is like a big, like lacerum, laceration, so it's a big one, okay? So if you just kind of follow the loop, you should be able to figure out those 8 foramen, okay? So we are actually done with all the bones and all the surface features of the skull.